This is our annual get-together to talk about the state of the Mailman Center and how we're doing. And this is always, as you know, a lot of fun for us to do because it gives us a chance to everybody be on the page and grasp the incredible things that our program is doing. I have to do it this way. As you know, our vision statement, which has really held up well for us, is improving lives through innovation, impact, and connection. And a lot of what I'm going to talk about today, in fact, all of what I'll talk about today, fits into that vision statement very nicely. We're here because of the generosity of Abraham and Joseph Mailman, the Mailman Foundation, the Joseph P. Kennedy Foundation, who gave the money along with the federal grant, the 903 grant that established the Mailman Center first in 1967 as a training program, and then the building itself opening in March of 1971. And Abraham Mailman made the statement in the Miami Herald the day of the grand opening. What about the 6 million children in America who already need centers such as this? Already in this center, children who have grown up hanging their heads are learning now to look up. And that was an important and insightful statement from him, because the question about what about the 6 million children is just as relevant today as it was in 1971, if not more so, and it's a larger number. The history of the Mailman Center, I think many of you have heard, but those of you who haven't, it's probably a good idea to at least cover it. We were one of the 11 original university-affiliated facilities funded in 1967 by a federal grant and the Abraham and Joseph Mailman Foundation, and the actually not the John F. Kennedy, it's the Joseph P. Kennedy Foundation. We were the third academic center at the University of Miami. The Debbie Institute was founded at the same time as part of the Mailman Center to create innovative approaches in childcare and development. And then in the Developmental Disabilities Assistance and Bill of Rights Act, or the DD Act of 2000, we are designated as a university center, specifically in the Act. And so that's really kind of our federal and philanthropic background of how we got to this. The original reason for the Mailman Center came about because of a tennis match. I think some of you heard me tell the story before of Eunice Kennedy Shriver and Dr. Robert Cook, who was chair at pediatrics at Johns Hopkins. Were playing tennis, and each of them has told me that they were beating the other one, and they stopped the match early, came to the net, and Dr. Cook says, you know, if we're going to move people with disabilities, particularly intellectual and developmental disabilities, out of institutions and into community settings, we're going to need a workforce. And that's the reason that the Mailman Centers of the world and the UAFs were funded, was to develop that workforce. As we look at our history, this is a slide I shared at the 50th anniversary a few months ago. We've really had a big trajectory of growth in our training, services, research, and community engagement. We started off focusing on individual children, primarily with genetic conditions, in the center. And we've moved through the years to a multidisciplinary, interdisciplinary, interprofessional, and community program. And then certainly a lot of our work has moved web-based. We were one of the first centers to really expand what it meant to be a UAF, UAP, USED, by including children who had neurodevelopmental conditions because of prematurity. And then we opened up the world to chronic illness and began to work in the area of infectious disease with Zika and, of course, with COVID. And then moved ourselves out of the center and into the community. Our research was center-based, developmental early on. It became hospital-based. We've done clinical trials. Then we began looking at service delivery and health services work. And that's expanded into community-based research. And then over the last few years, increasingly population-based research. And our community engagement, again, started with the community and really has started with the center, moved into the community, and in many cases now has global impact. The two slides are these newspaper clippings that I have here actually describe the fact that about a year after the Mailman Center opened, people in the school system and pediatricians in the community were complaining because they couldn't get their kids seen for evaluations at the Mailman Center. We weren't seeing enough kids. And so there was an additional $1 million increase, and we were able to boost our caseload by 75%. That was about 2,000 children. Today, as I'll share with you, we're at over 15,000 children, and I would venture to say we still are leaving a lot in the dust. For a big center, we have to have some organizing principles. We've got a lot of programs. Everybody's very proud of their program, but we all come under the umbrella of the Mailman Center ultimately. And you know, in their area of our vision statement of innovation, impact, and connection, we are required by the DD Act as a University Center of Excellence to engage in 4 primary areas, core functions, they call them: training, service, research, and dissemination. And we've organized, some institutions have a UCED over here and a LIND over here and a research program over here, and they're really not connected. I see some of you who know that nodding. We've made a decision over the years to use our UCED funding at the administrative core to organize all the programs of the center. And so we have our training program, which is primarily organized around our LIND program, Leadership, Education, and Neurodevelopmental Disabilities, which we've been continuously funded since the start of that program. We have disciplinary training programs, leadership pipeline programs, community education and training, and we've developed a distance learning online community learning program as well, and more to come on that. Our service, it includes clinical fee-for-service that's fairly traditional, but a lot of contracts. One of the things we realize, and folks don't realize this, if we relied on fee-for-service, given the contracting rates for our services in the community and trying to compensate folks at a low level, but at least at the 25th percentile for their specialties, we would lose about 25% on every faculty member we hired that just did clinical work on a fee-for-service basis. Every year, the center, we have to underwrite a deficit of a little over $200,000 just on our clinical services piece because the cost is higher than what the reimbursement. And that's a Florida issue, but it's also a national issue. So for that reason, we've done contracts, children's trusts, children's medical services, a variety of different programs that pay us to take care of kids. And then we don't worry about the fee-for-service component. And that really has enabled us to do some incredible outreach. In the research area, we clearly have had federally funded, foundation funded, industry funded, as well as trainee projects that go on under that part of the umbrella. And our dissemination, of course, is in the traditional things of publications, products, and presentations, but also development of best practices, which we share. And really importantly, over the last number of years, the community engagement and capacity building that we've been able to work in. We reorganized the center based on a strategic planning process that took place in 2014. And it was a little bumpy, but this was something that was really designed by our faculty, staff, our trainees who came in. We had working groups. We weren't sure exactly where it's going. And it really works and rotates around these interprofessional collaboratives, or the IPCs, and then we have folks who help to drive across IPCs some of our core activities in the areas of research and training and social justice and equity, community engagement, innovation, and clinical care. So each of the IPCs is engaged in 1, 2, 3, 4, 5 of those activities, but then they have a focus around the theme, and faculty and staff and trainees and even some community members participate in those IPCs to really carry that out. And the foundation for what we're able to do is some of our very large and longstanding programs, our Debbie Institute, Debbie School, the Early Steps program, our Child Protection Team, our new relationship with the Linda Ray Intervention Center, and our accredited disciplinary training programs. And those really provide us with a foundation for research and training and clinical services as we go along. This is the mugshots of our leadership. And I think it's really important. One of the things that some programs do is, and I actually was just talking to somebody the other day, really outstanding program, all centered around the one leader. And we made a decision when we developed the IPCs and the cross-disciplinary components that we didn't want to have that. We needed to have a breadth and depth of leadership. And so we really have an outstanding team that is working with us as leaders of our IPCs, our cross IPC direction folks that are assistant associate directors of the center. And it is really, I would put this team on the field in any World Series or NFL Super Bowl that you want to come up with. I'm not sure about the NBA championships because we're all a little short. But other than that, it's a really great team, and we are really blessed. We also have a phenomenal Mailman Advisory Council that is made up of folks with disabilities, parents of children with disabilities, folks who represent different community agencies, state agencies, the school system. And this group has been really instrumental over the years in helping us to look at what we're doing, make recommendations for where we're going. There are a number of programs that we have at the Mailman Center that were really the thought and the creation and the incentive to move forward came from our MAC. And so we're really happy to have that. We always have changes. I want to acknowledge those. We had to say goodbye to Winsome Thompson, who's been with the Mailman Center for 25, 30 years. She retired and moved into private practice. And we welcome Jennifer Walton, who's our section chief for developmental behavioral pediatrics. She plays an important role with the Mailman Center as our director of social justice and health equity and disability. And Jen, we're glad you're here. Wonderful. A number of honors and awards. I won't read through all of those right now, but I think, as you know, one of the things that you may or may not know, when the Mailman Center was initially founded, the deed of gift said that the director of the Mailman Center would be the vice chair of pediatrics, and the chair of pediatrics was to be the associate director of the Mailman Center. And that has been fun because I've always had a nice relationship now with 6 chairs, and we all kind of laughed at some point and said, okay, who fires who today? But it is a unique model that links us to the Department of Pediatrics in a really important way, and it helps to link the Department of Pediatrics to the developmental, behavioral, and special health care need issues that we are able to do at Mailman. So we're really happy. And as a function of that, we have a lot of people who have been recognized at various levels this year. I'm very pleased for that. We are also, if you ask somebody what's the Mailman Center, and they're on this campus, they might say it's that big building by the Metro Rail. Or other people may say, well, it's part of the Department of Pediatrics. Those are both true, but we are also a matrix center of the university. We're a designated center, federally designated, and as such, we work outside the core faculty of the Mailman Center, the Department of Pediatrics, to include faculty who work with us from clinical and basic science departments of the School of Medicine, and many, if not most, of the other colleges and schools of the University of Miami, as well as multiple other centers and institutes. And that really gives us an opportunity to connect and to have an impact in some very, very special ways. So one of the questions that we always look at is, what was what was the benefits of all these reorganizations and things that we've done? If you take a look at this, bean counters want to look at money, and so this is your money graph. In 2018-19, I didn't put everything on the schedule going back, but at 2018-2019, our total leverage funding, all of the grants that all of our faculty within the center, who have appointments in other departments, but who are members of our center, our total leverage funding was about 27 million. In 1999, it was 6 million. And this year we reported to the feds a leverage funding of 42 million. That's a huge increase, an eightfold, sevenfold increase since 1999 in terms of our funding. So whatever we're doing, people like to give us money to do it, and we'll keep working on that. Training was the core of the center. It was the reason it was founded in the first place. And we have a lot to be very proud of, and it drives what we do. We train about 100 new trainees every year. Over the last 3 years, we've trained 273, but 67% of those are from underrepresented minority backgrounds. We actually train more trainees who are of Hispanic background than 25%. We train 25% of the LEND trainees of Hispanic background that are in the LEND programs for the entire United States here at the center. We are a heavily female program. 79% of our trainees are female. That is not that odd for child health. That's happening in pediatrics. It's happening in education. It's happened in almost every field dealing with children. But what we also have is a large representation of people with disabilities or special healthcare needs or family members of those individuals. 61% of our trainees have a family member, have personal disability or special healthcare need. That means that we've got folks who really understand from a lived experience perspective what we're all about. Also that goes along with the underrepresented minority is that 55% of our trainees speak a language other than English at home. Most of that, 39%, are Spanish, but 16% are other in this area. It's primarily Creole, but it includes Asian languages because our folks come from actually all over the world in terms of their backgrounds. This is a little graph to show the number of trainees by discipline, and as you can see, we bring people in from a lot of different disciplines. They get their training here in their discipline, they get clinical experience, they develop those skills. But the reason that we really do a lot of the stuff we have is because we're also working on a fundamental issue of developing leaders in the developmental disability field, special healthcare need field in the future. And this is the progression, starting with our LEND training, this disciplinary and interdisciplinary leadership, the ETLP, the self-advocacy training program, our student emerging leadership program, our DASH program that's been developed for healthcare providers in acute care setting, and then really working on our progression across transitions in healthcare through our PATH clinic. These are all the kinds of things that we built over time to develop leadership among high school students, nurses, doctors in acute care settings, self-advocates, leaders in the community, professionals in the community, as well as trainees. And this is a really important pipeline that we have moved very nicely over the years. We also do a lot of community and technical, community training and technical assistance. As you can see here, we kind of gone up, and we had a banner year last year in all three of the areas of webinars and grand rounds and continuing education community trainings. But even looking at it, we reached 8,239 community people this last year through our various programs. I think that that's going to become more as we even come out of COVID, but develop a strong web presence. So some of the training accomplishments that I really wanted to highlight for us, we have a grant from the Agency for Community Living to expand the public health workforce and build capacity in underserved communities. Dr. Schenker and Nancy Torres are leading that effort through the Family Navigator, and we'll look at that in a little more detail in a few minutes. We developed the disability curriculum for Next Gen MD medical students. And we were one of the first medical schools to really develop that. It was the time that the AAMC was talking about the need to do it. We were already well on it. And I'll share a link to that curriculum and some of the components that have been developed in a few minutes. Our DASH program just came in and filmed a bunch of stuff last week. We're really bringing up the video. We did a lot of video for the 50th, and that has really flown for us. Our online learning community has increased now to 13 courses, very popular. Our innovation and connection conferences, we've had 2 of those. We had 275 attendees. You think we can only get 100 people in this room. So if it wasn't for the web, we wouldn't be hitting that. And our 50th anniversary, one of the things that was important, we had over 500 people join us for our 50th anniversary here in the auditorium and online, which was a wonderful connection to the community. Our YouTube channel has both the Mailman Center, the Step Up AT, and our online module channels this year had more than 32,000 views. So the community is reaching us through our technology. We've created a health equity and training work group, and that is moving forward with one of our identified strategic priorities. Particularly community wellness, IPC has done a lot of work to do infant mental health endorsed training to make sure that our staff are infant mental health endorsed and doing training for other organizations. So we're very happy to see all of that. Our clinical services world, this year, we served, that we can count, 15,222. We're working on our data. We're not sure that our data are actually capturing all the children we're seeing in the community. But as you can see, again, we are serving 77% of the children that we serve are from an underrepresented minority background. And so we are doing our mission in a really important way. And the column at the side is an example of all the clinical activities, contracted clinics that we have on campus, other things that are going on that help us to reach children and families with special needs throughout Miami-Dade County, South Florida, and in some cases, even reaching into the Caribbean and South America. Our Family Navigator was funded by the TAF program a few years ago. It has become a model for how to navigate and assist families with their services. And I know Nancy and Maite are very, very proud of that. You look at the little green line of families served. Since the program started, we've served over 3,000. This last year, we hit the high point, serving 614 families. Over on the side, you can actually see some of the statistics of who we're serving and their preferred language, their race, ethnicity, their age group distribution, the disability that they come in with. This last year, they trained staff at 6 PPACs. And since 2019, 23 different community agencies and 115 participants in the Navigator program. So it really is helping us it's a web that's going out and expanding, and I couldn't be prouder of the work that's being done and the impact that our Navigator program is having. all around. I put this slide up for Jumpstart. It's one of our programs that does outreach. Dr. Natali leads this, and the program actually started with a Dyson project. A lot of folks don't really realize that we had funding from the Dyson Foundation for the Community Pediatrics Program, had a small grant program that could get $29,000. And Dr. Natali and one of the residents came up with a project to look at perceptions of obesity and obesity in 3-year-olds in childcare centers. And it was also done with some folks in our GI division. And Dr. Lee Sanders was involved with it as well. That program evolved into Jumpstart, really connected, I think, Dr. Natali and her team to the childcare centers. They are now involved with thousands of children and hundreds of childcare centers in Miami-Dade County. And I put this slide up because hot off the press, they are being honored in we'll put this up as awards next year, but they're being honored by the Children's Trust as the Community Program of the Year. So we're very, very happy for the Jumpstart program. Our major clinical accomplishments or things that are in progress that are being accomplished certainly is our PATH clinic. I had to go over to see my primary care physician, who's one of our PATH Med-Peds physicians. And when I went over, it was he slipped me in. So he slipped me into the PATH clinic. It was probably an appropriate time. But I got to see the folks who were coming in, young adults who were just so pleased to have a program that recognized their disability and could provide them with primary care, that provided them with the supports and the information to not make it an antagonizing situation. The biggest problem we have with the PATH clinic right now is funding to be able to have it grow, because it is already starting to stretch the seams with the number of people who are wanting to be able to use it. Our behavioral health hub with psychiatry and behavioral sciences, Dr. Delamater, Dr. Coffey are really the leaders of that whole initiative. This is to integrate behavioral health into primary care practices funded by the state. Now, and I understand they funded more, and I've heard that there's more funding being considered in Tallahassee this week. So we'll see where that goes. Ruby has developed a network of child care centers that serve children with special needs, and that program gets accolades all the time. Our Healthy Steps program was refunded for another 5 years, and the impact of that has tripled as they've worked on that program this year. Dr. Hernandez is working with John L. Potter in OBGYN on the Thrive program. This and our VOCA program with South Florida Behavioral Health Network are two programs that are really focusing on the impact of trauma on neurodevelopment. Thrive is focusing on women who are victims of sexual trafficking and their children, and VOCA is focused on children who are directly impacted by violent crime. And so the whole area of looking at trauma and its impact on neurodevelopment is an area that's starting out as a clinical program, but has phenomenal opportunities for us in the research area, particularly combined with one of our longest standing and most recognized programs, our child protection team, that's been doing this work at the Mailman Center since, well, they actually had the office in the Mailman Center when I came in 1985. So we go back a while. Dr. Davis has been leading a team to bring Chattis, an internet-based way of capturing screening data and the like for developmental behavioral concerns in primary care settings. And I think we're getting pretty close to having that finally rolled out. We've installed observation equipment in multiple clinic areas as we're coming back live in terms of our treatment. And we are going through an integration of the Mailman and the audiology program and the children's hearing program, and a little bumpy here and there, but we're making some progress, and we will likely be investing in some new up-to-date booths and equipment in the audiology area in the near future. Alan did a really great job for pediatric grand rounds last week, really building on the history of research at the Mailman Center. And we continue to do great work, and our research activities are getting better and stronger as we go through. As you can see, we've gotten new grants, new IRB studies, and we're up to 52 active IRB studies right now at the center. And we're down a little bit on the number of grants submitted, but that's understandable. I don't want to use that as a negative, because when your total funding is 42 million and you haven't added a whole lot of faculty, that's about all you can handle. So we're going to hit a little bit of low place on new grants until we've got the old ones starting to produce so that we can apply. But I know of at least 6 federal grants that are underway right now to be submitted this next year. The outcomes, we always wanted to look at that. Our publications, we have 53 listed this year. We have a data capture problem because not everybody puts all their stuff into NEARS, and we have to chase people down. And I've done some things where I go into EndNote, and then I do searches on PubMed to find out who's got their publications, but that will only capture the peer-reviewed, and it doesn't capture the book chapters, which can be very important, textbooks, monographs, and the like. So this is an area you're going to be working on. But in those 53 publications, 98 trainees were co-authors. And so we're doing what we need to do to build a scientific basis for the future. And we had 107 presentations, local, state, national, and international. So we've been very productive in terms of those metrics for research outcomes. This is just a quick page of all the journals that we published in this year. Well, not all of them, some of them. And it's always good to see. I put the publication that Dr. Berkovitz was involved with that went into JAMA Pediatrics. We are seeing a shift in our work being published in higher impact journals. And that is a nice outcome of our research process to be able to see. And that really is shown in this slide, because this is the trend over the last 3 years. This was the number of citations that a number of times our work was cited by other people. And it was really based on going back 4 years. So you had a 4-year window to get cited, and we've gone from 353 to this year to 3,560 citations on the work we're doing. So we are having an impact. People are reading our work, they're thinking about it, and they're doing really good stuff with it. We have the area of innovation and community engagement, and this is an area that we've really been working hard on. We've strengthened existing academic community partnerships through collaboration on multiple federal, state, and county grant submissions. We've established a data squad, which I'll talk about in a second, and we've leveraged resources to support community initiatives. We've helped some of our partners get grants. We've helped them to write grants. I think we're right in the middle of helping write one right now. And we've done a lot of work in technology advancements in mHealth and telehealth, and our assistive technology program has now been funded, and it covers Broward and Miami-Dade County. It's certainly the largest and strongest AT program in the state. We've developed peer learning collaboratives and online learning, and we're going to be doing a lot more work. This is the group that will be helping us work on community-based participatory principles used in all the things that we're doing, as well as finding ways to utilize cutting-edge data and technology to increase our service accessibility and effectiveness. One of the things that we got out of our initial strategic planning and surveys was we need better data systems. And so we have organized the data squad. I wanted to call them the data geek squad, but they didn't want that term. They said that was Best Buy or somebody else. But what this group is going to be working on, it will be developing and assisting faculty in developing databases and systems that will allow us to permit reporting, tracking trajectories, doing analysis of program impact at both our program and global Mailman Center levels. And Dr. Nelly Garcia is going to take the lead on this with Adela Sanchez-Sarno, who we just hired and started a week or so ago, Alana Mansour, Michelle Shadat, and Jason Jen. And this will be working around REDCap. It'll also be all the stuff that we have to do for reporting and NEARS for AUCD for our reporting, and really helping us to develop systems that are not as complex. One of our programs that I've shared that we started off as a small idea in our last USAID grant. We put it out there and then things really took off. So I now chair a working group for the National Clinical and Translational Science Awards Program, working in collaboration with AUCD and the LENS, USAIDs, and IDDRCs and Autism Intervention Network in physical health programs. And the group is now meeting about every 3 weeks. And our task is to develop a toolkit for investigators to help them develop skills, knowledge, resources about how to engage individuals with lived disability experience as members of their research team, designing their hypotheses, designing the study, developing the methods, conducting the study, helping with human subjects and protections, participating to analysis, interpretation of a data, and actually serving as authors on manuscripts. The other group will be people with lived experience who want to be part of research teams, employed by research teams, and helping them to acquire the skills and knowledge necessary to do that. This has really taken off. We've been in touch with as I mentioned, several institute directors at the NIH about this project because they want to see if it can be modified to be applied to the populations that they serve in their various NIH institutes. So Mailman will come back as this toolkit develops to become a pilot site for different parts of the toolkit as it's developed, and we'll have an opportunity to pitch in and influence that as well. One of the things that we did as part of our 2014 strategic planning redesign was to establish a strategic priority of addressing the interface between disability and diversity. And with that, we developed principles of partnership. And the concept was that we would ask the communities that are in our area that we could partner with to identify their most critical needs related to developmental disabilities and special needs, their capacity to deal with those needs, and then areas where they could potentially partner with us and work together to come up with new solutions. And so we work with communities to help develop that capacity by helping them write grants, including them on our grants as partners, doing training and conducting research. And the model has held up, I think, very, very well for us. This is our list of our affiliations and community collaborations. It's a very, very long list. And this year, it grew some more. These are some of the new affiliations and partnerships that were just added by our IPCs, our various programs this last year. We know about the UHealth Jackson Children's Care Affiliation. It was a $16 million gift and 2 endowed chairs. We've just Dr. Brian Grodkow has just come and this week started at the University of Miami as our new chief of pediatric orthopedics, and is the first holder of the Shriners Children's Hospital chair in pediatric orthopedics. And Brian will be working with us to create pediatric orthopedic centers. We originally were going to have a pediatric pavilion out here on the grassy space. That plan is changing, pending the final approval from Shriners, and we'll actually be developing not only pediatric orthopedic Shriner centers at Jackson South and Jackson West, and maybe in the future in the north part of the county, but we're going to be expanding our whole pediatric ambulatory process, because we realize that to build something on this campus and then have people have to travel 2 hours from Homestead didn't make sense. And so we're really trying to build a multiple access site. Mailman will be a part of this as we go forward. Dr. Flores and I have been meeting with pediatricians and pediatric groups over the last year, and folks from Jackson have as well. And we really kind of thought, well, everybody said, well, I'm sure they're going to need cardiac specialists, and they're going to need pulmonary specialists, and they're going to want to have, hematology consults. And what we found uniformly is those pediatricians say, we need help with developmental, behavioral, and mental health services, and we need speech therapists. And that tops every other specialty in child health as we've worked with them. So we will be developing a way to help address those needs in the community. Our IPC was an experiment, but it's an experiment that seems to be working beautifully. This table just shows the number of faculty, staff, trainees, and community members who are participating on one or more of the IPCs. We have 146 people who are actively participating in our IPCs right now. And let's look at some of the quick metrics of those programs. Our Lifespan IPC has published 4 papers this year. They've done 5 presentations. They've developed the disability education curriculum for the Next Gen MD program. And this is the link. I was really kind of surprised. I'd never heard of Weebly.com, but when I clicked it, I got this beautiful picture of the boats in the water. And then there are things there for all the curricula that are being developed around disability for the program. I encourage you to go in and see that. And then I've already talked about our PATH clinic and the work that's really been led by our Lifespan IPC. The Neurodevelopmental Intervention Science IPC had 2 publications, one of those in JAMA Peds, 11 presentations. They've done an Innovation and Connections Conference and a grand rounds. And their clinical innovation has really involved the working on the Resources, Materials, and Technology Center for Deaf and Hard of Hearing, the RMTC-DHH program, as well as really active participation and leadership in the Miami-Dade grade level reading campaign. Well, a lot of focus on early childhood literacy and how to promote that. Our Promoting Behavioral Health IPC had 25 publications, 24 international presentations, grand rounds. They've been very involved in COVID around the vaccine hesitancy, several grants, the vaccine hesitancy specific to COVID-19, the POKE project. Dr. Gwen actually just got a grant from the Agency for Community Living through AUCD to do vaccine distribution to adults with developmental disabilities. And so we're really excited about that piece. They've also helped to lead us in the area of high-risk perinatal concerns, as well as the survivors of human trafficking and substance abuse. And a lot of work, as I already mentioned, in behavioral health care and integrated behavioral health care in the primary care area and in our work with our diabetes program. The Community Wellness IPC had 8 publications, 15 presentations. They've submitted 2 R01s. They've been our champions for the infant mental health endorsement campaign, and have also really been instrumental in helping Healthy Steps get refunded. Now serving over 1,000 children a year through our Healthy Steps program. Neurodevelopmental Discovery IPC had 8 publications, 10 presentations. They have 5 new grants, and as well as the supplemental land audiology training grant. And their advocacy work has really, Dr. Pfeiffer has been a lead on helping get the legislation done to do newborn screening for cytomegalovirus or CMV. And then I mentioned our strong base programs. Our child protection team provided services for 1,256 children related to alleged child abuse and neglect. 196 of those were non-caregiver cases. 1,060 were caregiver cases, and 977 medical exams and consultations, and 1,300 specialized interviews. And during COVID, the law enforcement, the Department of Children and Families, the state attorney's office really began to look to the CPT to participate in forensic interviews, and that burden and opportunity has grown, and really great work. And then, of course, CPT is a location for medical students, graduate students, interns, residents, and we just recently saw some of the feedback, and CPT got 100% rating from the residents for their training experience rotating through. Susie, you, Walter, and others are doing a great job over there. Our Early Steps program, these are the best people in the world because they've had to move. They've moved lock, stock, and barrel, and they've come home, because Early Steps used to be in the Mailman Center. We shipped them out and we brought them back. They are in the process of still packing boxes, hanging things on the wall, trying to figure out all the flow. In the process, they've served 3,925 children suspected of developmental delay and disability. 2,800 of them were identified with developmental delay. They do training for cohorts of North Dade providers twice a year. These are intensive 6-month training sessions. Importantly, we actually are responsible for the state program to evaluate the Early Steps program at the Mailman Center. And our Early Steps program here was one of the programs that participates in that. And more than 2/3 of the children that we see have exited the program with gains over time that exceeded what would be expected for their developmental levels. So we're doing really, really good work in promoting that all the way around. Congratulations to Early Steps on that impact. The Debbie School has served 215 children receiving center-based and virtual education and therapeutic services this last year. They've gotten new funding from the Florida Department of Education for the Bridge to Speech program. They are active in training. Trainings go through the Debbie School all the time. And we have research, Dan Messenger and Lynn Perry are doing work over there in social interactions of children with and without disability, and using some interesting technology in that work. I'll share that I ran into a parent of a child who was at the Debbie School about 20 years ago, just the other week. And when I told her that I was director of the Mailman Center, and she said, "That's where the Debbie School is," and I said, "Yes," and she said, "If it hadn't been for the Debbie School, they saved my children's lives." When they remember where they went to childcare, when 20 years later, you know that you're making an impact. So phenomenal work there. We are partnering increasingly with Linda Ray Intervention Center. They have enroll 41 of the community's most needy children, those affected by substance exposure, Department of Children and Families involvement, homelessness. 15% are affected by severe developmental disabilities such as autism spectrum. They've launched the Nurturing Parent Program, a trauma-informed, family-based program to treat and prevent child abuse and neglect. And they are established as a Fiddler's Multidisciplinary Center. and conduct evaluations, telehealth evaluations, and they are actively mentoring our LEN trainees and providing us with the occupational therapy faculty for our LEN program. We've got folks involved in a lot of policy and advocacy initiatives, including health equity in Miami-Dade County, the state health improvement plan, legislative initiatives for children, access to health care, the CMV screening that I mentioned a minute ago, the Florida Family Leaders Network, and DEI activities. We got together last spring on a nice sunny day and had probably more food than we could all eat, and spent a day doing strategic planning too. And coming out of that were 3 areas that we were able to reach consensus on as strategic priorities for us for the next 10 years. One was to develop and implement training in health equity and disability and evaluate the outcomes. So health equity will be a big part of our world going forward. To engage in community-based participatory principles, not necessarily research, but to use those principles in research, clinical services, training, community engagement, so that we really move into that field in a very big way. And to innovate and evaluate the use of technology to increase access to effective services. So we'll be doing a lot of work in the area of our technology work. I shared this with our steering committee and the retreat group. There is a model of change that suggests that you have an established system like the Mailman Center, big and doing things for a long time, and ultimately it gets stale and it starts to tail off. And when that happens, a new group comes in and said, we can do it better. And so then there's a period of disruption and change, and that it's hard to make that happen. And ultimately, after the change, the new system emerges. Well, we're looking at this in a slightly different way, an alternative theory of change, which is if you're smart enough to know what that model is, figure out when you're at the top of your curve and before you start to deteriorate, start the emerging system so you don't have disruption. And what do you do with all the things you've developed during that first phase that you're so proud of? You give them away. You disseminate them so that other people use them in other places in the community, so that we, as a Mailman Center, can be innovative in coming up with what everybody else is going to want to do in 5 years, so that we can share it with them so they can do it. And so this system of emerging change rather than disruptive change is something that we really want to grab hold of as we think about our strategic plan moving forward. Next steps, just to highlight some of those, are our integrated training curriculum around social justice, diversity, equity, and inclusion, developing a culture of community-based participatory principles, expanding innovation in the virtual artificial intelligence world. Are there ways to use AI? I had a conversation the other day about could we develop AI and actually give a person with a disability that uses an augmentative communication device that involves having to type to get the computer to speak? Can we speed that along using AI so they can have their own voice and they can more actively in real time participate more fluently? These are the kinds of opportunities that work on us. My own quote, I'm putting this into a paper I'm working on right now, is that the use of virtual platforms has advanced access and participation more than any intervention since the wheelchair for people with disabilities. Now we just have to make it better. We want to be able to use Mailman as a pilot test site for the design and implementation of including people with lived experience as part of our research teams. We want to develop and use population-based outcome measures for the work so we can show the impact at the community level within populations in addition to the individual. We want to take the DASH curriculum and really commercialize it so that it can go out and impact other health systems that provide care to children and adults with disabilities. and then explore innovative ways to provide access to mental and behavioral health services. We simply don't have enough providers. The statistic during COVID was that there was one trained behavioral or mental health provider in any specialty. So psychology, DBP, psychiatry, nursing, whatever. There was 1 to 18 every 1,800 children who had an identifiable mental health or behavioral health problem. We can't train people fast enough. So we've got to be thinking about ways to increase access, to change our models, to use technology, to do new systems so that we can get that access. All of these are the questions that are the answers to the question that Eunice Shriver asked me in 2008 about what's next. So where are we? Our driving principles for change are innovate, do things differently, lead rather than respond, to have impact, to make a difference, not only at the individual child and family level, but at community and population levels, and connections to do things together, both with our historic partners and with collaborators that we previously not considered. So I want to thank you. It's one of my favorite pictures. I got pulled into this, and I'm the ugly old guy with all the cute kids. But this is one of my favorite pictures because these are all children with disabilities representing various backgrounds. They represent the diversity of the community we get, and they're all happy. And that's what we want to be, is happy about what we're doing and why we're doing it. So I want to stop at that point and just use this as a chance to say thank you to all of the faculty, all the trainees, all the staff, all of our community partners for joining us and engaging in what is an incredible adventure and an incredible opportunity. Your thoughtfulness, your commitment, and your passion really can't be overstated. So thank you. We have maybe a couple minutes for questions, and there's microphones on the end here if somebody wants to ask. And I'm not seeing anything online. Anybody here? All right, good. Thank you. Everybody enjoy.